surgery. Welcome to this installment. It's not weeks because we're doing every 2 weeks now, but I don't know what to call it. But welcome to Vet Ranch Roundup. This is Vivian. If you don't know who she is, you should check out a couple playlists and get way caught up with all of our videos. I think probably 5 or 6 videos ago, she made her grand entrance. She's an orange-winged Amazon, and she is a rescue. We're still working on a lot of issues that she has, but we love her anyway. Right, baby? She's super worried about stepping up and hands, but anyway, you'll learn all that if you get caught up. Anywho, we had the transport last week, and it went great. Check it out.
As your cat's leaving for transport. Hold that.
Thank you. We also got a ton of donations again from a different Hollywood feed in Rockwall, which is so nice. But other than that, we have vaccines to do, and we are going to have Fresno's big surgery on this episode. So we definitely are nervous about that, but ready to get on a path to being pain-free for this poor cat. So let's just get started. Right, baby? Right? Wanna tell everyone hi? I'm nervous. Uh-oh, mister. Sorry. Hold on, sorry, Fresno. Oh, I'm sorry. That's it. That's all we have to do. That were removed from Fresno. Here's his femoral heads. I guess this is the week of body parts on gauze of me showing you that, but this is the one that was not as severely affected. You can see here it's more developed into a round structure. This one is round on part of it, but was where the growth plate is really eaten away. So poor dude. Let's look at those post-op x-rays. Fresno's post-op radiographs, bilateral femoral head and neck ostectomies. Looks beautiful. Here we have where the head is now removed in the neck, head and neck removed. So he is going to be a lot more comfortable. You can also see some bony changes around this this side as well. So poor guy. Now that's not going to be rubbing at all. After getting over the surgery, I think he's going to be a new cat.
Just waking up a little. All right, let's do this side.
I heard somebody was pretty grumpy yesterday after surgery. Hi. Oh, I think his Zorbium's starting to soak in. And guess what? We have a foster to adopt for him. Oh, that's not cute. We're not gonna do cute. Listen, if I send you to a home and you do that, what are these nice people gonna think? This older couple, huh? What's gonna happen if you do that? We just need to get a couple more days out. Is he moving around at all?
A little bit, not a lot.
He's using his litter box, so that's good. And that's a little litter box for a giant boy. Let's see if we'll walk around. Let's back up and see if we'll get out.
Come on, kitty kitty.
Come on, kitty kitty. Let's see how you're walking.
Kitty 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 kitty. Meow 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 meow. No.
When he was walking around in there earlier, he wasn't really putting weight on it.
Not either?
Like he was just a wheelbarrow? Or...
No, on like one leg.
Oh yeah, one was so much worse. He's so used to favoring that right side, I think is the worst one.
These are lazy.
Nope. Bring it to me. I will tap it. That is all.
I'm lazy.
I'm not grabbing him. Don't look at my fingers when I'm dragging you out. I know. Whoa, hi. Ouchie puppy. Aw, handsome.
Oh, wow.
Fancy boy. Oh, honey. So yeah, that hurts a little bit. Yeah.
Goodness.
Oh, what's the matter? Don't touch his belly though. I'll get you. That's
It's
his
a
no-no
no-no.
zone.
I have a picture that's a no zone.
No, don't touch me there. That is my no-no square. Right there. Right there. That's your no-no square. Right there.
He says I'm not a tummy tuck.
No.
You can pet me here, but do not go the neck.
That's his no-no zone. You did it. He's so worried you're gonna get towards his hips is what it is.
Yeah.
Yeah. He's definitely late. He
It's
saw me twice
like
now.
it's like a person with back problems. You're like, don't touch my back.
Well, he's probably had his whole life that somebody didn't understand.
Look, he's
okay,
like,
we're done
I'm
with
round
you
up.
for a while.
Okay, fine.
He's probably had somebody his whole life not understand that he hurts there, just called him a jerk cat.
I know.
Sometimes I'm a jerk and I don't even have that pain. What's my excuse? You're making him mad.
So sorry. You're not happy. He's swatting. Do you have any kitty yet? He wants some wet food. He deserves it. Oh,
Man, I gave him some tuna last week left over
Did he
from.
love
Oh
it?
my gosh,
Oh, yes.
loved it. Hey, Roll, you're making him mad. I'll give you some canned food, Bubby. That was a long one.
I'm sorry.
Don't, April. I know you want to touch him right now. We got a whole bunch of donations from Hollywood Feed. Again, look at all this stuff they hooked us up with. Toys, tennis balls, ooh, tons of treats, food. They are so awesome. We thank them so much for their partnership. Aw, someone can get a little jacket vest. Thank you guys. Today is surgery day for our little head tilt Gomez, but they were telling me how cute Gomez and Beasley are. Just a couple old fogies just poking around. He's like, she said I'm getting neutered today. Nope. Well, someone's gonna have to adopt these two old fogies together. I says, I'm gonna apologize first that I'm gonna be a little bit hateful today.
That's okay.
But you know that, and you know
That's
I'm really
okay.
sweet in my heart.
That's sweet.
When you do stuff to me, I get hate in my heart. We forgive you, Bubs.
Oh my goodness.
So here's Gomez's penis, and I believe extra testicle is right about here inside the abdomen. So we're gonna go through there and then bluntly dissect from there, since this is off midline. Now we can see his abdominal wall there. Tint that up. Gonna break through that. Abdominal muscle there, break through that. Good. One more layer. So now I'm in the abdominal wall. Usually these testicles we can feel or see them at this point, but I'm just gonna feel first before I have to go visual. It's just easier sometimes. Haha! Felt the spermatic cord there. So since I felt that cord, I retracted it up. Now I'm gonna trace it. Bam! That's a testicle, my friends. That is a retained testicle that was found. Yep, Yeah, clapping all around. And we'll compare it to his testicle that is not retained. But this one undoubtedly is a lot smaller. We just need to ligate this guy here. Sometimes these testicles are really, really hard to find. But since we could not feel it in the inguinal canal, just with experience, because I've done so many of these, I just knew that's about where it would live. So what we do is we go in there and just dissect it out just like we did. So this is a classic, simple abdominal cryptorchid procedure. Now we have our whole testicle there. I'm going to go ahead and clamp that and ligate that as well. Excellent. All of that looks good. Tuck everything back in. He does have a lot of abdominal fat there, or actually extra abdominal fat outside the abdomen. But the key moving forward from here is to close his abdominal wall. And these incisions are often much different than our spay because we dissect it out. So what I like to do is get a good grab, tuck everything in, and you may not be able to appreciate, I'm just getting both sides of that abdominal wall there. What we don't want to do is do a bad job here, and this poor dude end up having an abdominal hernia because this hasn't healed correctly. I'm just tucking that abdominal fat back in, making sure I'm getting a good healthy grab of his abdominal wall. We don't want to suture any abdominal fat, intra-abdominal fat, inside the abdominal cavity. Fat out here because that can mess with our healing of the incision. Okay, that is the cryptorchid part. Now we're going to move on to his normal neuter, but we're going to give it a quick scrub and go from there. Okay, here we go for his regular testicle, which we know is there. So we're just going to take care of that real quick. If she needs to go home or whatever, it's all good. So here is our normal testicle that was there and our retained testicle that was about here. And as you can see, these retained testicles, it looks normal, but it's definitely not as enlarged or big. Not large, this one's not enlarged, but it's definitely not the same size, and that's common. Sometimes if they look really weird or super small or anything strange about it, we'll send it off. So we'll get with Dr. Carey about that. But Gomez cryptorchid surgery, neuter complete.
All right, I want to show you these teeth. They are not good. Look how much gingival recession there is and how much tartar. It's the first time that we've really gotten to look at them. So dental as well for you, my friends, and then we'll talk about your ears. We're done with his teeth cleaning. Looks better. We extracted premolars and molars. And now we're gonna get the first super good look deep down in his ears. See all of that exudate in there? I don't wanna pack it down anymore, but I do wanna get a sample of it. Never recommend using cotton swabs when you're cleaning your dog's ears. That might be a good one to do a video of, ear cleaning at home, but I can see where I'm going. I'm just trying to clean some out to be able to see down there. But you can tell his little ear canal is so just stenotic, meaning it's kind of scarred down to a smaller space. Even though there's a lot of inflammation and kind of brown yellow exudate, it's a million times better than it was when he was first here. And he has some toothpaste on his ear. There's like a Simba Mufasa moment going on. Look at the cat room really fast. He's trying so hard. Hi, baby. Yeah, he can probably go outside. But you might want to do the yard where he can just walk.
Okay.
He's not gonna want to be on a leash. He said, I don't want to eat right now. I don't feel good. Stuff happened today that I don't want to talk about. Baby. Reminds me of Eeyore sometimes. Gomez, day 2. So much brighter today. He does not appreciate his ear meds, but what's new? Yeah, eating good. Poor baby. You're too much, Bird. What is this head under the wing thing? Is it good? That's nice. That's a shower. Uh-huh. Oh, goodness. Bath time. Fancy. Oh, baby. Vivian. You want some too? Ooh, ready. What's out here? 21-ish. Christopher! Oh my goodness, hello! Hi! Alright, we're doing boosters today on Mr. Chris. What? I'm gonna give you a snack. We're gonna do those first, then we'll look at your skin. Hey, look! Look! You get a bath tomorrow. Okay, those are done. Bath tomorrow. And now you get to go in Gen Pop. Yeah, you don't have to be alone anymore. Who do you want to be friends with? This is a little kitty swaddle. It definitely helps with grumpy cats. We'll show you when we draw blood. Hopefully this isn't the one time that I get proven wrong. But Butterscotch is a client cat and she's super mad. More about this now that we're not as hasty. This cat's super angry. We could not hold her with regular scruffing, which cats really, that kind of makes them more irate sometimes. So we put her in this cat swaddle. Chill, 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 chill. If we preemptively think about it too, we'll spray it with Peel Away, which is a pheromone. And it has these little flaps where you can give vaccines and, you know, have access to the cat. And these are great just for a person to have at home that wants to be able to trim their cat's nails and stuff like that. So anyway, I'll put a link for these. A fellow veterinarian makes these. She started out hand making them. I don't know where she is in the process now, but they're awesome. So we'll put a link up to these. Look who can probably come out of isolation. He didn't even care about being in there. That's the thing about Oliver. He just played in the yard. He's like, I have this whole yard to myself.
No, he misses his friends.
You want to go see Denver?
Yeah, his girlfriend.
I know. Did you miss her?
It's like he can't get traction to go faster on the floor.
Excuse me, sir. He's like the cheese whiz is up here.
Yeah, I
I heard.
think this is your food.
It is his food?
Yeah.
I don't have it. Denver, I have a surprise for you. Your boyfriend's coming back out of isolation, your best friend. Over 2 weeks without him.
Go see your girlfriend? Did you miss her?
Oh my gosh, twins!
They're gone. What are their names?
Starsky.
We cannot say them. What's their name?
Starsky and Hutch. Starsky. Starsky.
Starsky?
Shaborsky.
What are you saying?
Shaborsky, Crystal, and Hutch.
Oh, that's $7. You gotta go fast. Look. Do it like you mean it.
And we have a little spot that we're gonna check out to see.
Oh
if
my.
it's-
Great.
Yeah.
I think there was a spot on this back leg. Yeah, right there. You see?
Belly.
Mm-hmm. And this.
Down there. There was a spot next to the umbilicus. That's not.
Right there. Yeah.
What other spot?
Oh.
No.
Well, shoot. Oh.
Oh.
Anything on-
Don't.
I don't know. Might as well just dip these little kiddos. Yeah. Anything on your friend?
Beep, 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 beep.
We're at a club. Oh my gosh.
I didn't see anything on her.
I didn't either.
Well, she's going to this.
She's not disgusting like a brother. They've been hanging out, pouring in together.
Go in.
Nail trim.
Oh my god. It was like
Get that. Yeah, yeah. I do not, knock on wood, get ringworm from dogs. It's only
it no matter what.
grody little cats. So I'm gonna adopt this cute puppy.
Look at these sad little babies. Ringworm. This is what happens. They're like, no fair. Why are you upset? We all have to smell you too. Oof. They're like rotten eggs. Well, guys, we're wrapping up a super successful couple weeks here on Vet Ranch Roundup, and I want to say thank you guys so much for joining us. Definitely, if you're thinking about donating, now is the time, because we need donations more than ever, because it is in my blood, in my bones, to rescue everything I can, but I can't do that without donations, so please consider donating. It would mean the world to us. Also, wait, here's a link. See, I'm getting better. Also, if you've been here a while, back in the old school days, you remember this song. We get asked about it all the time, and I love it. But Dustin Ruth reached out and said, yes, use that song. Yes, I have more songs coming out. So we definitely want to use his songs because they just bring so much joy to my heart. And I think they captivate our spirit perfectly. With that, I'm gonna leave you with one of our all-time favorites, and you guys enjoy, and we'll see you on the next installment. Bye, guys.
Sometimes when you're feeling young and you're feeling tough and you're all caught up, but you don't walk right and you don't talk right, and there ain't nothing wrong with feeling strong, but I know what you're going through. I know, 'cause I've been there too. I don't walk right and I don't talk right, and there ain't job and making money. But I wanna be cool for you, baby. And I'm just a fool for you.